students, today our class is going to be on the topic of implants. See, what we speak regularly is about dentures, FPDs, and things like that. But definitely, we know as time goes and progression is happening, so implants is definitely in the move right now. So, in this, we will be covering about history, introduction, components, classification, different designs and different systems and conclusions, and I will also be mentioning some points about implant failures. What is basically an implant? It is an object or a material such as an alloplastic substance or any other tissue which is partially or completely inserted or grafted into the body for therapeutic, diagnostic, prosthetic or experimental purposes. That is the definition of an implant. What is a dental implant? A prosthetic device made of alloplastic materials implanted into the oral tissues beneath the mucosal or periosteal layer and or within the bone to provide retention support for fixed or removable dental prosthesis. Implant does not always mean you're going to give a fixed prosthesis. Implant also has an option where, see, implant can be used for two things. One is for retention and the other is for support. Retention in the sense your whole prosthesis is going to be retained by the implant, whereas in case of supportive implants, your prosthesis is going to have an added support from your implants. Okay. So in a dental implant, what all comes in a dental implant? You have the implant body or the fixture as you call it, which goes inside the bone. On top of that, you have something called as an abutment. Okay. Then on top of that goes the crown. So when you have, if this is a normal tooth, let's say a premolar tooth, this root portion is the replaced form of implant. Okay. Now let's say you're doing a tooth preparation. You have a tooth preparation. This is how you will do a tooth preparation on top of that, right? So you have your crown is gone. This is how a tooth preparation will look like. This segment will compensate your abutment and of course your crown like a normal tooth preparation crown. Short history, Greeks and Egyptians were the first ones to use implants in the form of jade and bone to metal. Ox bone was used in Albuquerque. Tooth implant transplantation was done by Pierre Fauchard and John Hunter, and gold roots were fixed to pivot teeth by Maglio. Harris did platinum postcode and also gold and iridium tubes. So there was a long list of history. But then you came to Brannemark. This was the history of modern implants. Modern era of implants started by around 1967. Brannemark was the first person to use titanium implants in 1978. So that's why Dr. Brannemark is called the father of implantology, modern implantology. Okay. And then, of course, it kept changing over the period of time. Coming to the components, what are all the components that you have in an implant? You have implant body or fixture. You have a cover screw, which is like a small cap or a covering for your implant fixture. You have a healing abutment. You have an impression coping. Now, impression coping can be two types. You have a closed tray impression coping and an open tray impression coping. You have something called as an implant replica, and then you have an abutment. Now, I will be explaining each of the components and how it is used. So, implant body. First one, we will discuss about the implant body. What is the implant body? It is the fixture, that is, which is a part of the implant. See, when you talk about an implant, you are generalizing an implant. Implant body is the part or the titanium screw part which is going to go inside the bone. Okay. This is surgically inserted into the jawbone. There are different types. It can be threaded or non-threaded. Either it can be plain or it can be with threads. Okay. Now it can be round, it can be conical, it can be cylindrical. Conical is very rare, but yes, it is there. Most commonly used is titanium and titanium alloys, either pure titanium rather than pure titanium. Titanium alloys, especially type 4, is used because it is better in strength. Again, with or without hydroxyapatite coating is depends on the surface treatment that you're going to do. Why titanium? Titanium, why? Because titanium has this property of osseointegration. It's a pure attractive property by titanium. Where you put titanium implant, it attracts bone cells around it. So what happens is, in blood, it tends to call all the bone cells and gets itself to be attached to the bone cells. So it firmly binds onto bone. That process is called as osseointegration. Next is a covering screw. It's also called as a healing screw. So, in a case where you are going to put the implant and cover the gums on top of that. Imagine this is your implant. Okay. Now, in your implant, you have a space in the center. Why? When you have to put your abutment, when you have to put your crown, anything that needs to go inside here, because your abutment has to seat into this and screwed here, right? So you need a space there. Imagine having to leave your abutment or your, let's say, your implant just like that, covering with the gums. Your gums will grow over this and grow into this, right? You can surgically take this off, but how will you remove this inside portion? That is why you need a cover screw. So you put a cover screw, a small screw, which goes and locks this small opening. It does not touch the other part of the implants. So this is how it looks like. This is a small diameter. This is the center portion, and this will go and close inside that. Next is your healing abutment. So implant procedure, you have either a single step implant or a double step implant. So in a two-step procedure, so first you put the implant, you wait for some time for osseointegration to happen. So in that meanwhile, you're putting a cover screw there. Once you open up surgically for exposing your implants, what happens is you're cutting and you're opening up. You cannot again put the cover screw, because every single time you're going to take your impression or go for the process, you have to cut and open again. So what happens is, either in that step, or if you're in a single step where you're directly going to load the crown, you put something called as your healing cap, healing abutment, or a permucosal extension. It is exactly like a cover screw, slightly longer than that, with a shaped border. So this is how it will sit. It will stand out of your cover screw. Now this is also called as a gingival former. Why? Because once your healing abutment is placed, your gums will heal, but your gums will heal around your healing abutment. So what happens is, once your healing abutment is removed, you have a good gingiva which is formed around your tooth structure, crown structure. So these are the different shapes. You have square, you have tapering, depending on your location. Especially in the anteriors, it is preferable to give tapering. Why? Because you need to get an emergence profile for your anterior tooth. Next is abutment. Now, abutments can be different types. You have solid abutments, you have hollow abutments, you have let's say multi-unit abutments, you have ball attachments, you have plastic abutments. Okay, all these. This is a multi-unit attachment. This is a cylindrical abutment. This is again a short height cylindrical. This is a solid abutment. Okay, this is of course a healing abutment. So abutment is basically the part of the implant which resembles a prepared tooth or designed to be cemented or screwed into the implant body. So this is again a hygiene cap, also called as a comfort cap. Coming to the impression post. Like I mentioned earlier, you have two types of impression post, closed trays and open tray. So it is a part of the implant that facilitates the transfer of the intraoral location to a similar position of the cusp. Simple. You have an implant which is inside the bone. How will you make an impression? How do you know where is the implant? So what you do is you take an impression coping, okay, as it is called, is an impression coping or an impression post. Take it and attach it to the implant. So now inside the patient's mouth, you have these pillar-like things standing out, right? So that is the position of your implants. Tightly screw it in, take an RVG and check if it is fully screwed in and seated properly. Then you make an impression of this. Now you have two types of impression. You have closed tray and you have open tray. In closed tray, what happens is you make the impression just like a crown and bridge impression. So once the impression is removed, you remove the coping from the patient's mouth and replace it into the impression. That is closed tray impressions. Whereas in open tray impression, they will be longer and it will come out of your tray. So while making the impression, you remove it along with the tray. So when you're taking out the impression, the coping comes along with the tray. You don't take it and fix it separately. Okay. So this is how I said, this is how impression post will look like. This part will go and seat into the implant. This will be inside the patient's mouth. Now you have something called as an implant analog. Implant analog is nothing but a replacement of your implant to go into the cast. Now you have an impression coping inside the impression. Once you pour the cast, what happens? You have nothing to fabricate the prosthesis. You have to put the abutment, you have to make the crown, right? So there has to be something like a replica of the implant inside the cast so that this can be done. So you have an implant analog. So once the impression is taken out, you attach your implant analog to the impression post and then pour the cast. Apply separating medium and then pour the cast. So when you take out the cast, your implant analog is inside the cast and your implant post impression post is outside and you remove the impression post. So basically what you're trying to do is you are trying to actually replicate your patient situation in the cast in the same way where your implant is inside and you are going to place on top of that. These are the three different type of posts. This is called as a snap-on post or a closed fit post, and this is a closed tray impression post, and this is a open tray impression post. You can see the difference. This will be longer and the screw is longer. So this will come out of your tray. You need to cut your tray for a open tray impression. That is why it is called as an open tray impression. You cut the tray open. Once you place the material through the material, this impression post will push out, and then you have to remove it from there and it comes out along with the impression. It is always best to use a closed tray impression post for single implants, even snap-ons. But for multiple implants or a full mouth case, it is best to use a open tray impression post. Now here you have the impression post and onto that the implant analogs are attached. Okay, and then you pour the cast. So analog it can be a replica of your implant body in the cast for laboratory purpose. So this is how an analog will look like for different companies, different shapes. Most commonly, this is how it will look like. It doesn't have screws, but it rather has some indentation so that it sticks to the cast. Prosthesis retaining screw. You have various type of screw, right? So this is the prosthesis screw. What is a screw? It will be a longer screw. It will go through your crown and fix it into the implant. So this is how it will go. This is the crown and this is the implant, and this is how your prosthetic screw will go and fix into the prosthetic space. Coming to implant classifications. So these were the parts of an implant. Coming to the classifications, you have based on the surgical procedure, based on the design, based on the material used, and based on the reaction with the bone. Also based on the implant abutment surface, body shape, and implant to bone surface. Depending on the surgical procedure, I did mention we have single stage and two stage implant procedures. Single stage mostly for immediate loading cases, and double stage for let's say for full mouth or for delayed loading. Based on the reaction with the bone, you have bioactive surface or bio-inert surface. Bio-inert surface is usually metallic like titanium. Bioactive surface is surface coated implants. Based on the materials used, you have metallic implants like titanium and titanium alloys, non-metallic implants like carbon and ceramics. Based on the designs, you have subperiosteal, transosteal, endosteal, and epithelial implants. So this is something called a subperiosteal implants. So here you are only at the periosteum level. You are not going into the bone. Okay, covering the periosteum. That is what is called as subperiosteal implants. Designed to rest directly on the bone underlying the periosteum. So it is resting on the bone. It is not into the bone. They typically employ a custom cast framework that adopts closely to the bone surface. Mostly used Vitalium alloys, and it can be used for both maxilla and mandible, most commonly for the mandible. Next is subperiosteal. In subperiosteal or transosteal bone, next is transosteal. There you are going. Transosteal means from here to here, across the margins of the bone. It penetrates both the cortical plates on top and below and passes through the entire thickness of the alveolar bone. It has to be more than 6 mm of vertical height of bone is required. If it is greater than just 5 mm bone width, and the advantages would be for to provide excellent stability through bicortical stabilization and predictable longevity. Disadvantages only for indicated for the anterior mandible. Why? Because posteriorly you have the inferior alveolar nerve, upper you have the maxillary sinus and your incisive nerves. So mostly it is only for the anterior mandible. See, these were all older implant designs, now not very commonly used. Endosseous implants, this is the type of implants where we are using commonly now. Two types, either it could be ramus or blade form or root form implants. Okay, root form implants are the most commonly used now. There you have press fit, you have self-tapping or pre-tapping implants. Now, these are the different designs for endosseous implants. You have something called as a blade design. Then you have root forms also. Endosseous root form implants, prosthetic advantages is it mimics the basic shape of the natural root and available in a variety of length, width and design, may be used in any area of the mouth. Prosthetic advantages, it may replace one or more teeth in cases where sufficient bone height and width is available. Next is intermucosal or submucosal implants or inserts, something like mini implants or orthodontic mini implants. They are button-like non-implanted devices. You are not waiting for osseointegration in such cases. It's just for added retention. So this is how it might look like transmucosal inserts. They are like multiple inserts which is placed inside the denture and the patient's mouth. Now coming to the implant abutment interface, you have external hex and you have internal hex. That is, the joining is either inside or outside. So here it is external hex, other one is internal hex. External hex extends 1 to 2 mm above the coronal surface of the implant, whereas in internal hex it's about 5 to 5.5 millimeter into the body of the implant. This is how an external hex looks like. So you have the implant platform which is below and the hex is above. Okay. So the attachment is above. In an internal hex, it's straight opposite. You do not have an elevation, you have rather a depression. So it is placed and screwed within. This is how an internal hex looks like. See, this is a depression and the screw goes right inside there. So this is the implant abutment junction. You have either it is flat or you have tapered, and you have something called as a platform switch. The implant abutment junction can incorporate rotational resistance or lateral stabilizing geometry. Internal non-rotational features could be octagonal, hexagonal, cone screw, cone hex, cylindrical hex, and pin slots. Coming to internal non-rotational features, you have, this is very common, you have something like this. It's called as the Mickey, most commonly seen for uh, Noble Biocare implants. Okay, and then you have hex like this, hexagonal. So these are all the non-rotational features where you don't want it to be there. You don't want it, you want it to lock. You don't want it to rotate like this. So if it is circular, just imagine this is circle and this is circle. So there is a tendency for it to turn. Whereas if it is like hexagon and hexagon, it goes and locks inside and doesn't turn. This is the maximum flex it has. It doesn't turn 180, it's full 360 degrees. Coming to the body geometry, you have different designs where you have threaded screws, you have press fit cylinders, you have hollow basket cylinders. Okay, so these are the different geometries. This is threaded screws with holes. Without holes is what is used most commonly now. Threaded cylinders. You have tapering or cylindrical. This is, and you can have surface modifications like you have, it is coated with hydroxyapatite or surface treatments with acids. Okay. Various implant surfaces like I mentioned, hydroxyapatite coated, acid washed, and this is porous. Okay, and machined implants and spiral, titanium spiral. So this is again machined implants. With this, we conclude about implants. Thank you.